Very importantly is the exposure to adolescence. And the adult brain is really not fully developed until the early 20s. And so if you take someone in their teens, their whole prefrontal cortex, which is kind of the highest functioning part of the brain. Remember I talked about executive functioning and data and synthesizing and planning and executing a plan. Well, they don't quite have that yet. And that's why we need to kind of coddle adolescents and put some barriers around them, because they're impulsive, they're omnipotent, you know, they think nothing bad's going to happen to them, they're novelty seeking. And exposed to this drug, we have demonstrated through studies that adolescents run the risk of having a reduction in their intelligence quotient, their IQ, by 8 points. And this persists. It's not an acute thing related to acute exposure to marijuana. It persists. So it could be, you know, if someone's born with or has a very, very high IQ and they lose 8 points, you know, they may be able to absorb that loss, but for someone that's on the borderline, that can make a significant difference in their functioning. The other thing is that it can definitely cause psychosis. I talked about hallucinations and delusional thinking. But if an adolescent is predisposed to mental illness, let's say they have a family history of schizophrenia, so there's some genetic risk for them, exposure to marijuana can accelerate the onset of the disease. So with schizophrenia, most of the time, the onset is in late teens, early 20s. And it's very sad that they get that disease anyway, but at least it's a little later, and they've had some time for psychological, social, academic progress and development. If that develops 6 years earlier, you know, instead of 20, say age 14, they have less life experience, they have less social development or psychological development. So they're really put at a greater disadvantage with a disease they'd probably get anyway, but the onset is much earlier. We've seen this phenomenon in hospitals in Colorado called cyclic vomiting syndrome. And it tends to be in younger adults. And they're coming in and they're getting these expensive workups, gastrointestinal workups for who knows what, because they just have this intractable vomiting. And it's actually a side effect of heavy chronic marijuana use. And what I've had hospitalists tell me that I talk to is that, you know, they work them up, they cannot find anything wrong. They get a urine test, it's positive for THC. And the parents are just in disbelief when the doctors say there's, you know, there's nothing to explain this disease-wise, but exposure to this drug is causing this. It's very, very hard for the parents to conceptualize and accept. When I talk about addiction, what we know is that in general, 9% of the population will become dependent on marijuana. But you need to look at that, you know, with a more granular view, because if the use starts in childhood, the risk of addiction is 1 in 6, not 9%. And if you have an adult who is smoking marijuana regularly, meaning pretty much every day, the risk for addiction rises to 25 to 50%. So again, you think of marijuana being a much more benign substance when it was less potent, but what's out there today does lead to a higher rate of addiction. And that just kind of compares. The first blue bar is tobacco, which still, you know, continues to be a terrible public health problem. And the red is the marijuana, and at the far right is heroin. So proponents will argue, well, look, this is a lot less dangerous than other drugs. But, you know, again, we're talking about times when there was lower potency, and they're talking about a general number rather than looking at specific populations at risk. Okay, I'm going to end with just talking a little bit about the impact as we know it as of August 2014. The Rocky Mountain High Intensity Drug Trafficking Area is a group that sort of tracks things that happen in our state, like traffic fatalities, reports to the Poison Control Center, emergency room visits, hospitalizations, arrests, all kinds of things, just tracks trends. as related to different substances, and this was specifically looking at marijuana. Okay? So between 2007, when medical marijuana was legal, and 2012, when recreational marijuana became available, the traffic fatalities involving marijuana increased 100%. And what's interesting about that, that is occurring at a time in Colorado when traffic fatalities related to alcohol are trending downward. And that's partly due to stricter law enforcement, better educational campaigns about not drinking and driving. So we have just the reverse with marijuana. We rank very high in the nation for youth. In Colorado, for children, it's 4th in the nation. For adults, it's 3rd in the nation. And for those adults, that's 42% higher than the national average. So I think you can conclude that legalization leads to higher use because people are less concerned about legal ramifications. In 2013 alone, about half of those arrested in Denver had marijuana in their system. And in a 2-year span from 2011 to 2013, emergency room visits related to marijuana intoxication or overdoses increased by about 50%, a little more than 50%. And hospitalizations, again, strictly related to marijuana use, increased 82%. Some other concerning things is that children being exposed to marijuana in an unintentional way, meaning the children got a hold of their parents' edibles or secondhand smoke, the exposures increased by 268%. And I want to be honest about that the overall numbers are small, but the trend is very concerning for that kind of increase. And interestingly, from 2008 to 2013, the interdiction seizures of marijuana, meaning marijuana going out of the state, increased almost 400%. And we are getting a lot of pushback from our neighboring states like Wyoming and Nebraska because they've had to put more resources toward law enforcement to try to protect their borders from marijuana being exported to their states. So we're not the best neighbors in the homeowners association right now. I mentioned the butane hashish oil. Just in 2014, there were 24 explosions in labs where they're making this concoction and 27 pretty serious injuries. And the injuries are primarily burn injuries from these explosions and people getting skin grafts from these injuries. And also pets being poisoned. The Poison Control Center is tracking that. Now, probably what, if you think it's okay to use marijuana, but you're concerned about the bottom line in your state, this is probably the most important slide I have to share with you. And the proponents of this really entice people by saying you're going to make a whole lot of money and your deficits are going to be taken care of. And the projection for Colorado was to make between $65 and $100 million a year off the taxation, and other types of money-making revenue for marijuana. But in 2014, we're between $12 and $30 million revenue in October. It's almost the end of the year, so it's way below the projected amount. And what's even more concerning is it's estimated that we need over $1 million just to pay for all of this, for law enforcement, for regulation oversight, and the legislation we had also put money toward education campaigns, put money toward substance use disorder treatment, and research. And so we're way below what we need for those things to happen. The reason we're way below is because, one, we are an export state. The black market is very large. The amount of marijuana grown in Colorado right now is in abundant supply and too much for the population, so it's going to other states. Two, the taxation on recreational marijuana is extremely high. So people are either getting medical marijuana cards because the taxation is a little low, or they're buying it from their next door neighbor where there's no taxation at all and they're getting a really good deal. And there have been reports of some dispensaries buying marijuana from the black market. So all the tax revenue we thought we'd get is not really being realized because of a alive and well black market. Okay. So you can just keep, pushing that. So as I've looked at this as a physician and as a member of the community in Denver, what really came to my mind is that if you have increased access to a substance, there's going to be increased use. It's just available, it's easier to get. And if you have increased acceptability, you're going to get more use. And it's very interesting for a lot of people. The fact that it's legal, they make the assumption that it's safe. And there are a lot of things that are illegal that aren't safe, right? Look at the tobacco industry, and you can see this very much parallel what happened there. And then looking at societal costs, and I think we're realizing that in Colorado, okay? And just, for me, the most vulnerable actually are children and adolescents, but also the patient population I serve that has mental illnesses, and they don't need anything else aggravating an already very sad and painful disease, okay? So some things to think about is, one, I'm personally in favor of decriminalizing. There are a lot of young adults or kids who made bad decisions at an early age, and I don't think they should go to prison for those bad decisions unless they were actually dealing drugs and hurting other people. But if they were using and it was kind of naive, we shouldn't put them in prison. We should divert them. And we have to think about this whole concept of medicalizing marijuana in the absence of the kind of research that other treatments are required to have before a drug goes to market. And certainly defining medical practice by ballot initiatives isn't a good idea. And I've had very lively and interesting conversations with a lot of people about that, and some of them have opinions like I do, and other people are vehemently opposed to my ideas. But the tension appears to be between individual rights, and I can understand that, let me live my life the way I want to, and then public safety. And there will always be a tension there, right? And this week what I've been talking about is some people may feel very comfortable driving at 110 miles per hour. But on the road, the other people in those lanes, are they feeling safe with someone driving 110 miles per hour? And that's why we have speeding limits, right? And so I just apply kind of the same logic to this. Where do we draw the line? If this is legal, who should have access to it? How do we regulate it? We're not regulating it very well in Colorado so far. Okay. And I'd love to hear your comments and questions. Thank you so much for your attention.